Hi, Dr. Alec here. Today I wanted to talk about shoulder pain as it relates to your rotator cuff muscles. The shoulder joint itself is a ball and socket joint, and it's very unstable. The reason it's unstable so that way you can do all the movements with the shoulders that you want, going up and down, left and right, whatever you really want to do with your shoulders in terms of reaching, playing, throwing. And so during that time of its instability, something has to stabilize it. And that's where the rotator cuff muscles come in. If you know the acronym SITS, that's pretty much all the four muscles that make up the rotator cuff. It's the supraspinatus, infraspinatus, subscapularis, and teres minor. And primarily what all of those muscles do is they suck in your humerus into the scapula, creating stability, so that way the big prime movers like your deltoid, the big muscle here, can actually do its movement. Without that, you're going to have erroneous movement, which will produce pain, inflammation, and injury. So the injuries that can happen to the rotator cuff muscles happen due to the attachments of these muscles that attach from your wing or your scapula to the arm or to the humerus. And so what happens is there's different reasons these injuries occur. One could be that your posture decreases the room of where the tendons from these rotator cuff muscles actually are housed in. So therefore, there's a lot of friction that's created with all the movements, and the tendon gets inflamed or even ruptured. Also, it could be a sports injury that someone tackles you and you fall right on your shoulder, and the tendon gets pretty much torn off. Also, the degeneration of the bones itself that are above these tendons. You can have little teeth type looking structures, little spurs that are coming off the bones that also could be rubbing on the tendons as you're doing your arm movements. And so with time that will wear out. Think of the tendons also as your socks. If you keep wearing the same socks over time, you're going to start getting holes in them, so they're going to start wearing out. Same thing can happen to your tendon. Repetitive motions, throwing motions, things of that nature. So if you're experiencing pain in your shoulder, it's coming from your rotator cuff muscles. The great news is that we have some awesome exercises that can help you reduce those symptoms. In my next video, I will show you the best exercises for that. If you go ahead and subscribe to this channel, it will give you more information on some of the aches and pains you can experience in your body.